Deep listening is a very effective technique for dementia residents and dementia units, especially if you're determined to understand their perspective and you pick up both the verbal and non-verbal cues in present moment observation. There's much to be learnt because the person that's living in the dementia unit will have a lot to tell you. It's not like they're now at home where everything's been the same old thing for the last 20 years. They're now in a completely different environment, so they will have things to communicate with you. So if you can be observant and tap into all these cues, it will be very helpful. So for example, if you come into the dementia unit, it's morning or afternoon tea, you can check out with your parent whether the cup of tea is being delivered in the way that they like it. Do they have enough sugar? Is there enough milk? Is it exactly as they like it? Can they enjoy it? Because often it's little things like the cup of tea that can make all the difference in a dementia unit's daily life. I mean, if the cup of tea's got too much milk, too much sugar, and they don't like it, you know what that's like, having sweet milky tea when you like it just with a little bit of milk and just half a teaspoon of sugar. It means that, you know, your day's undone if your cup of tea's not right. So the way to go about this is to say, sit down with your mother at morning or afternoon tea and just go through everything step by step, verbal cues and non-verbal cues, using the observation skills. So the cup of tea's there with mum, she's got it on her lap, and just say, look mum, how's your cup of tea? And if she just shakes her head and says no, then go through it and say, well, is it hot enough? No. Is it too sweet? Yes. Too milky? Yes. Okay. So therefore it needs to be hotter, less sugar, less milk. So be the spokesperson for your parent. It's really important because it's actually difficult, quite difficult, for dementia residents to put forward their viewpoint to staff. They're busy, they're flat out, they haven't got time to listen. You've got to be quite assertive to be able to put forward opinions, whether it's about a cup of tea or food or heat or volume of music or whatever. It's really only about 3-4 out of 30 dementia residents who have the assertiveness to be able to put forward their views to staff confidently. So be the spokesperson, go to the charge nurse or the carer and say, look, I'd just like to mention that mum's cup of tea, she likes it hot, little bit of sugar, little bit of milk. And then what will happen is that the carer or nurse will put it in the clinical notes that will be brought up at the staff meeting that they have when the changeover happens, and it will go through the system. Now, do recheck on this because sometimes, if busy, it may not get noted, but say it a couple of times, then for sure it will go through the system. Come back again for another morning tea and make sure that the cup of tea's as your mother likes it. Then from then on, once in the system, it will just carry on through. So that's one example. Another example could be if you're in the bedroom with your mother and she's looking cold, well, just quite simply, you need to say, Mum, are you cold? If she's not communicating clearly. And if she goes, yes, well, that's it. You know that you need to work on getting all the warmth arrangements going, like warm cardigan and heater in the room maybe, and duvet for the bed, and just go through it all with her. Well, Mum, would you like me to bring in a jersey or a cardigan? And she may not be able to speak, so just say, would you like the jersey? And if she goes, yes, okay, so that's right, bring in the jersey rather than the cardigan. Would you like a duvet on your bed, Mum? Yes. Would you like a heater? Yes. Okay, so that's all sorted. Mum's now warm and comfortable. So it's just, a lot of it is about observation, about the cup of tea situation, the cakes, the food, and also it is actually a good idea to come to a meal, well, actually a few. Come to some meals to be with your mother at the dining table. Lunch, breakfast generally lunch and dinner are good times to come, and sit down with her and see if she's eating, if she's enjoying the food, and if there needs to be any change. Now, if you're sitting there with her and you're noticing she's got a really big meal and she's always been a small eater, just say, look, Mum, would you prefer to have less food? And if she says yes, again, note that to staff. If she wants less meat, again, to staff. But maybe she would prefer to have the vegetarian options, which are really good in dementia units, macaroni, cheese and pizza and such like, rather than having heavy meat meals all the time. So many things you can do in regards to observation and helping out. Now, another thing that often happens in dementia units is that the music that's put on the TV is loud, boppy music, more for the staff's enjoyment sometimes than the dementia residents' enjoyment. And it's really stressful, sitting in a lounge all day with loud music going while the staff are up the corridor doing the care, so they're not exposed to it for the whole time. And if it's very demanding to sit all day listening to loud music that's not of your taste. So if that is the case, if you can be witness to this, and maybe ask one or two of the other dementia residents if they find it loud as well, maybe a friend of your mother's, you can say, look, June, are you finding the music loud as well? Mum is. And she's, yes, we all are. That's okay. So you've got that in place. You know that at least, you go around a couple of people and ask them, is it too loud? And then so you can say to the nurse with confidence, the residents really are finding it too loud. Can the music be, taken down a bit so that they can relax and enjoy the day? They're finding it stressful. So these are really important things. I mean, it's not that you're going to be making complaints all the time, and they're actually not complaints. It's good constructive feedback, because it's the dementia residents that live there. It's their home. They need to be comfortable. They need to be warm. They need to have the volume of the music at a level that they can tolerate and hopefully even enjoy, and have their cup of tea the way they like it. And it's not a big thing once everything's in place. It will just go on forward. But unless you say something, things won't change, and it can be very difficult then for the person in the dementia unit. Now, in terms of listening as well, it may be that your parent, the cases I've mentioned, are for people that have difficulty communicating, and it's really just with the yes-no answers that you're getting the feedback. But many dementia residents can speak, but they just get stressed sometimes and the words get a bit mumbled and jumbled. But if with your mother, if you can see she's trying to say something to you, just sit down with her and say, Mum, I know that you're wanting to tell me something. I'm here. There's plenty of time. Take your time. We'll work it out together, what it is you're likely, that you're trying to tell me. Now, it often is the common question is, when will I see you again, dear? So you can say, look, Mum, are you wanting to know when you're going to see me again? And if she says, yes, dear, work that through and say, okay, well, look, whatever the arrangements are going to be, if it's Saturday at 2:00 once a week, tell her that, and set up a system like a diary, or better still, a whiteboard in her room where you can write up, John comes, visits every Saturday, 2:00. And she knows it, the carer knows it, everyone knows it, it's in place. She can look forward to that, and she doesn't have to sort of get stressed or confused or upset or worried about when she's going to see you again. So all these topics and more in the 2 books I've written, The Resident's Voice and The Resident's Rise, both from a dementia unit, and on Amazon and on my website description below. So all the experiences of the residents, how they cope and manage in dementia units, and what resources they need are in these books that they've generously informed me of. So thank you for your likes. Please subscribe.